In this part, I want to talk about the secondary lymphatic structures. The secondary lymphatic structure house the lymphocyte and other immune cell in the reticular connective tissue matrix. Before I start talking about these secondary lymphatic structures, you need to know that all of the lymphatic organs are made up of a reticular connective tissue, and the reticular connective tissue is made up of reticular fibers and reticular cells, and we call them matrix. This reticular connective tissue is dark brown or black in their color because they are argyrophile and they like silver staining, and they can make a tissue capsule. From the capsule, some invaginations come to the organs, and these invaginations are called trabeculi, and between these trabeculi we have reticular cells which are very similar to the stars, as you see in this picture. And the function of this reticular connective tissue is making a framework for holding and hosting the lymphocyte and the other immune cells. And we have the same reticular connective tissue matrix in all of our lymphatic organs. They are organized into lymphatic organs and aggregates of lymphatic nodules. And the organs have a complete capsule of dense irregular connective tissue like a spleen and lymph node. Some of them, their tissue capsule are incomplete like tonsil, and some of them doesn't have a tissue capsule like MALT or mucus associated lymphatic tissue, and also the diffuse lymphatic nodules. And in this part I will talk about these structures. The lymph node is the organ which can filter lymph, remove unwanted substances. As you see in this picture, the lymph node is kidney shape or bean shape in its structure. It's very small. It has a complete tissue capsule around, and from the tissue capsule we have some invaginations which come inside, as you see here, and these invaginations are called trabeculi or septa. Our lymph node is divided into two major parts. One part is located in the peripheral part of our organ. This part, which I mark it with black arrow, we call it cortex of the organ, and one part is located in the center, and we call it medulla of the lymph node. So our lymph node is divided into two parts. One part is located around, as you see here, we call it cortex, and one part is located in the center, and we call it medulla. If you remember from the first video of this chapter, I told you that the aggregation of lymphocytes around each other can make lymphatic nodule or lymphatic follicle. And all of these round structures, which you can see in the cortex, are lymphatic nodules. Each lymphatic nodule itself contain a cortex or mantle zone and the germinal center or medulla. So our lymph node cortex contain many lymphatic nodules, as you see here. And also we have the cortical sinus, which I will talk about it later for you. But in the medulla, the organization of our lymphocytes are not like the cortex. They cannot make lymphatic nodule or round structures. They can make the cords like these yellow cords, which you can see here, and we call them medullary cord. The aggregation of lymphocytes are like chain. They are located one after each other, and we call them medullary cords. In the cortex and medulla, we have many sinuses, and I talked about sinuses in the chapter of blood vessels. The sinuses or sinusoids are capillary type 3. And these capillary type three are located in different parts of our lymph node. One of them is located in the cortex, and we call them cortical sinuses. And you can see them here, the cortical sinuses. And the other one is located in the medulla, these blue parts, and we call them medullary sinus. But what do we have in these sinuses? First, you should know that your lymph node is very similar to a bean or kidney bean. And you see that we have one indented part here, and this indented part is called hilum or hilus. From the hilus, one lymphatic vessel come out. We call it afferent lymphatic vessel. And from the peripheral part of the organ, we have many lymphatics which come to the organ, and we call it afferent lymphatic vessel. So afferent come inside the organ and efferent leave the organ. The afferent bring lymph to our lymph node, and in the lymph we may have some pathogens, we may have some tumoric cell, we have some bacteria, viruses, or dead cells. And the function of this lymph node is doing phagocytosis and removing of all of these pathogens and unwanted material from the lymph. So the lymph which come to our lymph node may be full of cell debris and pathogens, and the lymph which leave our lymph node is clean. And it's important to know the direction of flow. The direction of flow, as you see by the green arrows here, is from the tissue capsule. From the capsule, the afferent lymphatic vessel come to the organ, and then this lymph is start to move in the cortical sinuses, and then to the medullary sinus, and after that it goes out from the efferent lymphatic vessel. The other thing which is important to know is this: the cortical sinuses is divided to two different parts. One part is located beneath the capsule here, we call it subcapsular sinus, and one part is located around the trabeculi, and we call it trabecular sinus. So the lymph first come to the subcapsular sinus, then trabecular sinus, then medullary sinus, and after that it goes out by the efferent lymphatic vessel. So in the lymph node, the node's cortex contains lymphatic nodule, the reticular fibers support a germinal center, and we have many B cells and some macrophages here. And in the surrounding mantle zone, we may have some T cells, macrophages, and dendritic cell. And the cortical sinuses are tiny open channels which are lined by the macrophages, and these macrophages can do phagocytosis. And in the medulla, we have medullary cord, the connective tissue fibers that supports B lymphocytes, T lymphocytes, and macrophages are located in the medulla, and between medullary cords, we can see medullary sinuses, as you see in this picture. And again, the sinuses are covered and lined by macrophages. In this picture, you can see the other structure, the other picture of the lymph node. I told you that the lymph node is kidney shape, and you have the tissue capsule which is green here. From the capsule we have some trabeculi which come to the organ, and these are the trabeculi, but these trabeculi are not complete like the lymph, like the thymus, sorry. The organ is divided to two parts. One part is located around, we call it cortex, and you can see the cortex here, and one part is located in the center, and we call it medulla, which you can see it in this part. In the cortex, we have lymphatic follicles, as you see here, but in the medulla, we have medullary cord. In both parts, we have sinuses. The sinuses which we have in the cortex is subcapsular sinuses, and after that, we have trabecular sinus, and in the medulla, we have medullary sinus. We have afferent lymphatic vessels, which are numerous. They come to the lymph node, they bring lymph to the lymph node, and after that, the lymph come out of the efferent lymphatic vessels. And you can see the types of cells which we have in each part. In the cortex, in the germinal center of each of these lymphatic follicle, we have B cells, follicular cells, and macrophages. And in the outer cortex, we can only see the B cells. And the cells which are located in the inner cortex are T cells and dendritic cells. The inner cortex has the other name, which we call it deep cortex or paracortex. And I want to mark it with blue color for you. The paracortex or inner cortex is located here. It's located in the boundary which we have between cortex and medulla. And in this part, we have a T lymphocyte. And the cells which we have in the medulla are B cells, plasma cells, and macrophages. You know what is B cells, you know what is macrophages, and I will talk about plasma cells later for you. In this slide, you can see the direction of lymph flow. It starts from the afferent lymphatic vessel, then subcapsular sinus, trabecular sinus, medullary sinus, and efferent lymphatic vessels. The lymph flow through the lymph node. The lymph enters through several afferents, as I told you, and the lymph is monitored for presence of foreign particles. When it passes through the lymph node, macrophages can remove foreign debris from the lymph. Lymphocytes may initiate immune response, and lymphocytes do proliferation, specifically in the germinal center, and they can cause enlarged nodes when we palpate them in the axillary region and in the cervical or neck part when they become enlarged at the time when they initiate immune response. And the lymph exit node by the efferent vessels and may enter nearby lymph node within the cluster of the nodes. First, I want to talk about lymphoma, and then I will talk about the location of lymph node for you more. The lymphoma is the malignant tumor or neoplasm from the lymphatic structures. It's non-tender, enlarged lymph node, and we have possible night sweat, fever, and weight loss. And we have two types of lymphoma. One of them is called Hodgkin lymphoma, which affect young adults and people over 60. And if we can diagnose it early, we can remove this lymph node and do radiation and chemotherapy after that. But we have a non-Hodgkin lymphoma too. It's more common and it's very aggressive, and it grows slowly, but it's aggressive and it can affect the other lymph nodes too. And the lymph nodes are about 600 in their number in our body. They are most abundant in our axillary region, in the cervical region, abdominal region, and also in the groin region. But we can see them in the other parts of our body as well. The other structure is the spleen. The spleen is the largest lymphatic organ which we have in our body. It's located, let me bring the picture for you and show you in the picture. It's located beneath the diaphragm. This is the diaphragm. It's located beneath the diaphragm in the left side of our abdominal cavity. This part of abdominal cavity is called the left upper abdominal quadrant. And it's located on top of the kidney. The posterior lateral part is convex and round, and the anterior medial part is concave, and in this concave part You can see one indented hilum. The hilum is the place where the blood vessels like a splenic artery can come inside and the splenic vein can go out. And this organ, as you see here, is covered by a tissue capsule. Trabeculi form capsule, trabeculi come from the capsule and they are formed by the connective tissue. Inside the spleen, we have two regions. One region is these lymphatic follicles, and one region is between these lymphatic follicles. These lymphatic follicles are called white pulp. They are clusters of T cells and B cells, and also macrophages. And here you can see this schematic picture of the white pulp. And in the white pulp, we have one artery, which we call it central artery. And around the white pulps, we have the other part which is red in its color, and we call it red pulp. Red pulp because it contains many red blood cells. We have platelets, we have macrophages, and we have B lymphocytes. In the red pulp, we have a splenic cord. The splenic cord are the cells and the reticular connective tissue which we have in the red pulp, and we have a splenic sinuses or a splenic sinusoids. It's a capillary type 3 which are located between the cords. They can store many red blood cells and platelets for us too. The spleen has a very important function. It can monitor the blood as it flows through the spleen. The spleen filters and monitor the blood. Pay attention. The spleen doesn't filter the lymph. It only filters the blood for us. We have white pulp, which monitor the blood for foreign body and bacteria. The macrophages in the sinusoids of red pulp can remove all particles. They can do phagocytosis of bacteria, debris, defective erythrocyte and platelet. The path of flow in the spleen is from the splenic artery. The blood comes inside, it goes to central artery, and the central artery are located in the white pulps. And after that, the venules and the splenic vein take the blood away from the spleen. So the spleen can eat foreign particles. It can clear defective erythrocyte, which I talked about it in the first chapter of this semester. It can do phagocytosis of aged red blood cells and also platelets. And the other function is a storage of platelet and red blood cell. And in the first 5 months of fetal life, the spleen can make blood cells. This is a site of hemopoiesis in the first 5 months of embryonic period. This function can be reactivated when we have blood cancers or bone marrow cancers or some hematologic disorders. Again, the spleen starts making blood cells for us. And when we remove the spleen, we have a process which we call it a splenectomy, and may be performed due to rupture the spleen when we have abdominal surgery. Infection, different cysts and tumors can lead to a splenectomy, lymphoma and other cancers, and some blood disorders like sickle cell anemia. At the time of sickle cell anemia, because the function of the spleen is removing these defective red blood cells, all the blood vessels may be blocked and we have problem with the function of the spleen, and we need to do a splenectomy. And it's more prone to a life-threatening infection. The other lymphatic structures which are partially encapsulated are called tonsils. They are secondary lymphatic structures. They can do immunity for the inhaled and ingested substances. And in the tonsil, we don't have a complete tissue capsule around the organs. If I want to draw the picture of the tonsil, it's like this. The tonsil has many invaginations inside. These invaginations are called tonsillar crypt, and around this tonsillar crypt we can see lymphatic follicles, and these are the lymphatic follicles. And around these follicles you can see the tissue capsule which cover it only partially. The particles which we ingest or we inhale, if there are any pathogens inside, they can come to this crypt, and then the lymphatic follicles around the crypt can catch them and destroy them. So the tonsillar crypt are the invaginations which can trap material, and it's a very significant key for identification of tonsils. And the lymphatic follicles or nodules contain germinal centers. We have three main tonsils. One of them is called pharyngeal tonsil. It's located in the nasopharynx. I will talk about these parts of pharynx later for you, but the pharynx is this tube which we have in the back of our oral cavity and nasal cavity. And in the back of nasal cavity, we call it nasopharynx. In the back of oral cavity, we call it oropharynx. In the nasopharynx, we have one of the most important tonsils. We call it pharyngeal tonsil. When it becomes infected, we call it adenoid, and we should do tonsillectomy at that time. The other tonsil is called palatine tonsil. The palatine tonsil is located in the posterior lateral part of the oral cavity, and the other tonsil is called lingual tonsil. It's located in the posterior 1/3 of our tongue, which we call it base of the tongue. We have the other minor tonsil, which we call it tubal tonsil, and it's located in the opening of eustachian tube, and I will show you this tonsil in lab. Tonsillitis is the inflammation and infection of the tonsil, and palatine tonsil most commonly affected. They become red and enlarged, and sometimes they can block and obstruct the pharynx. We have fever, chills, sore throat, and difficulty in swallowing. And the infection can happen by the viruses or bacteria. And the persistent recurrent infection can make chronic tonsillitis, and we need to do tonsillectomy and remove the tonsil by surgery. The other parts of our lymphatic system are called lymphatic nodules and MALT. The lymphatic nodules are clusters of lymphatic cell, and they are protected by the tissue capsule. And they are scattered nodule, which we call them diffused lymphatic nodules. They find in every part of our body, specifically in the connective tissue beneath the epithelium, and they can defend against different infections. And in some areas, they group together to form larger structure, which we call them MALT. And the MALT is mucus-associated lymphatic tissue. They are located in the gastrointestinal tract, respiratory, genital, and urinary tract. We call them, we can see them, in the lamina propria, and the lamina propria is the connective tissue which we have beneath epithelium. In digestive system, I will talk about lamina propria more for you. But for now, you need to know that the lamina propria is the connective tissue which we have beneath epithelium. And they can help defend against foreign substances. They are prominent in a small intestine, specifically in the ileum. And in the ileum, they have a specific name. We call them Peyer's patch. They are large connection of lymphatic nodules that form the bulges in the ileum wall. And in this picture, you can see the MALT. They are aggregated lymphatic follicles or lymphatic nodules in the connective tissue of lamina propria, and this connective tissue is located beneath the epithelium. Only we can use the Peyer's patch term for ileum. And in the next slide, you can see the relationship of the lymphatic system and the cardiovascular system. In this picture, you see that at first we have lymphatic capillary, and the lymphatic capillary of the intestine is called lacteal. The lacteal can do reabsorption of fats, and the lymphatic capillary can do reabsorption of fluid, which are remain in the capillary bed after filtration and reabsorption. And you see that these lacteal and lymphatic capillary have only one direction, and all the directions are toward our heart. They combine together and make lymphatic vessels. The lymphatic vessels can make lymphatic trunk, and the lymphatic trunk can make two lymphatic duct. One of them is right lymphatic duct, and the other one is the thoracic duct. And this lymph can return back to the subclavian vein, and by the subclavian vein it can go to our heart again. And the other part which can help our cardiovascular system is the spleen, red pulp of the spleen. It can do phagocytosis of old and defective erythrocyte and platelet from the circulating blood, and it can serve as the blood reservoir and a storage site of erythrocyte and platelet for us. And the lymphatic structures which can help the immune systems are here. You can see the primary lymphatic structure like red bone marrow and thymus. They can make lymphocytes. B cells can mature. The red bone marrow can mature the lymphocyte to the B cells, and the thymus can do maturation and provide and make T cells. And the secondary lymphatic structures are lymph node, which can monitor lymph for foreign material, a spleen which can monitor blood for foreign material, tonsils which can provide defense against pathogens which we have in our food or inhaled air, and the lymphatic nodules or MALT can protect body organs against different harmful substances. And don't forget, the term of Peyer's patch is only used for the aggregated MALT in our ileum, and ileum is the last part of the small intestine. And in this part, you can answer these questions. What is the typical ratio of afferent and efferent vessel at a lymph node? Which side of our body is the spleen on, and which direction does its hilum first face? What functions does the red pulp of the spleen serve, and what is the Peyer's patch? Let me know if you have any questions in this part.